Hi, my name is Troy, and I will be talking to you about the Active Living Policy Coalition. We all know that being active is good for our health, whether that's walking for fun or transportation, riding a bike or skateboard, dancing, playing a sport, or having some fun at the playground. But sometimes where we live makes it really hard to bike or walk to school, work, or the store. It's just not fun or safe to walk or ride along big roads with fast-moving cars. And it's hard to have to walk long distances between the places you need to get to, and to have to cross major streets that just aren't built for pedestrians. That's why we need to have policies in place that help reduce barriers to active living. Active living policy can help create a built environment where everyone in our community has access to what they need to be active, and do it safely and conveniently, regardless of age or ability. What this looks like is safe and accessible sidewalks, bike lanes, play areas, parks, mass transit, and crosswalks, along with good signage to help us find our way as we walk or wheel. Being active is strongly correlated with lower incidence of many chronic diseases and reduced obesity. Unfortunately, in Jefferson County, the rate of obesity has increased in the last 10 years from 12.9% to 19.7%. And low-income families have a higher risk of obesity, inactivity, and poorer health. Only 34.7% of children meet the minimum recommended 60 minutes of play of physical activity every day. And only about 1/2 of Colorado teens report participating in vigorous activities most days, which leaves a lot of people in Jefferson County not getting the recommended amount of exercise and activity that they need to reduce their risk of chronic disease and obesity. There is great progress being made, however, toward making our community more active. 5 of Jefferson County's municipalities have already joined the Live Well, Heal Cities and Towns campaign, with a resolution that commits each to policy and systems changes that encouraging active living as well as healthy eating and worksite wellness. Local communities in Jefferson County work together in the Gold Line Corridor Light Rail Study to encourage transit-oriented development that makes walking or riding to transit, stores, work, and school easier. And many of our communities are adding complete streets and wide sidewalks to already existing roadways. That's good news, since walking only 30 minutes a day, 5 days a week, is all adults need to maintain cardiovascular health. That brings us to the idea behind this coalition, which is that we can make Jefferson County even better. We can work together to figure out what needs to be improved, and then work together towards ensuring that all parts of our community have equitable access to the infrastructure they need to be active. The Active Living Coalition plans to work towards new local or county policies that make being active easier. The coalition plans to provide capacity building, technical assistance, and a forum to share information about land use, transportation, and programs that will foster healthy and active places where people live, work, and play. Yes, these are big plans, but the good news is that we have some great resources lined up to create real change. First of all, many of the people who are in this room right now have already started on this work. A coalition called the HEAL Policy Team has been meeting for 3 years and deserve a huge thank you. Can everyone who's attended the HEAL Policy Team meetings please raise your hands? Also, with the help of the team, the county applied for and received state grant funding to support this effort going forward. We'll wrap this up by saying something that all of you already know, but that really bears repeating. Numerous studies show that active people are less likely to suffer from diabetes, heart disease, cancer, depression, and a host of other diseases. Being active is also fun and an important way of creating community. Thank you.